Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi there, I'm Dr. Carrie Bennett. Please see our disclaimer. Nothing here is meant to be direct medical advice to you, but an offering to help you understand some of the things that we look at around breast disease. I promised you a talk on the difference between Lcis and Dcis. What are those, you say? Well, inside the breast is mostly made up of fat. And then the main ingredients inside the breast are the lobules, which produce the milk, and the ducts, which bring it out. There are also suspensory or Cooper's ligaments, as well as blood vessels. But the main makeup of our breast is fatty tissue, and then the functional cells that produce milk. 80% of breast cancer is inside the ducts, and 20% is in the lobules. That ductal cancer is more easily seen on mammogram. So mammogram is very good at picking up the ductal carcinoma. Now we're going to talk specifically, say hi to Lucy, my puppy. We're going to talk specifically in this talk about the in situ diseases, or IN space SITU. Lobular carcinoma in situ means it's abnormal cells inside the lobule, and ductal carcinoma in situ means it's abnormal cells inside the duct. The thing that even many clinicians do not understand is LCIS is only an indicator of your future expression of breast cancer. If you produce LCIS in your body, seen on a biopsy, LCIS means that you have a 10-fold increased chance of expressing breast cancer in the future, and it follows the normal expression of breast cancer, which is 80% ductal and 20% lobular. So lobular carcinoma is not cancer. And a lot of times when it's found on just a core or minimally invasive biopsy, we do not excise it nowadays, although we used to always excise it. Back in the old days, like 25 years ago, not that long ago, people would have full mastectomies for this disease. But nowadays we know that we can monitor with ultrasounds, mammograms if needed, physical exams, as well as MRIs if needed. And these are all individually titrated. Often with LCIS, if we're following it, you will have a mammogram every year, followed by an MRI 6 months later, and then a clinical breast exam by your OBGYN, PCP, breast specialist during the year. But LCIS is not cancer. Now, florid, or a lot of LCIS, florid LCIS is a certain pathology where excisional biopsy is needed at the time of core biopsy. And please see my other talk, which talks about the different forms of biopsy. Now, ductal carcinoma in situ means that the cancers are inside the ductal cell and not spreading outside. At the time of excision of DCIS, 10 to 20% of people will be found to have invasive disease, and that may change your management. We do not check lymph nodes at the time of DCIS about almost 100% of the time. There are always, we never have always or never in medicine. There are always sometimes a reason why we might do that. But in general, lymph nodes are not checked with DCIS. The treatment is surgery, and then often about a month later, radiation. And then after that, a pill often for estrogen receptor positive DCIS that people take to prevent cancer, often taken for about 7 years nowadays. There's a variety of different medicines, especially for people who are postmenopausal, and you would see a medical oncologist to discuss those options after surgery. So LCIS also is something where I would send someone to a medical oncologist because we want to do prevention strategies. So we want you to follow all the recommendations on the breast health sheet or the breast health info talk. You can look at that. And then you also see a medical oncologist for possible medication for risk reduction. Again, the number one way for risk reduction is try and get there moving outside, connecting with nature for 30 minutes every day, and increasing fiber and fluid in our diets minimizing alcohol, getting good sleep, and implementing stress management techniques. So LCIS is not cancer, DCIS is. DCIS has 100% survival, 10 to 20% of the time gets upgraded to invasive, but you still would have 100% survival, and the treatment is usually the same. Neither requires a full mastectomy. LCIS does not always require surgery. DCIS almost always does. So hopefully now you understand some of the basic differences between LCIS and DCIS.